Good morning. I'm Matt Schwartz, chair of the Worksite Wellness Council of Louisville, here with Andrea Doty,
Hi.
who is not only a dietitian, but she's a diabetes educator with with Louisville Metro Public Health, Department of Public Health, I guess, and Wellness. So we just finished a program talking about diabetes. And why would we be talking about diabetes? Is it a small problem here in Kentucky and in the U.S.?
It's a major problem here in Kentucky, and I really appreciate you guys having me out today to talk about it. It's a major epidemic here, and also all around the country. We're talking about maybe 10% of adults now have diabetes. And so we were talking about some of the evidence-based ways that you can improve that in your work site, but really for anybody to improve their diabetes is to engage with some lifestyle management programs, some diabetes self-management education is a huge one, because we need to know how to take care of all of the wellness behaviors that we're asking people to do, which are a lot with diabetes. There's a lot of self-care involved. So we talked about how to bring some of those to your organization, what some of that return on investment might look like, or why diabetes is so expensive in the first place. And I guess the big take-home message is a lot of times it is preventable, or at least delayable, with things like the diabetes self-management education and also the National Diabetes Prevention Program, which can be brought to your work site. So we talked about how to engage with some of those things, and I guess my takeaway is give me a call if you have any questions about it.
So now that you said there were the big three, if I have diabetes, you're going to tell me to do three things.
Right.
You're going to have to help me.
Okay.
Lose weight, exercise, improve my diet.
Eat healthy.
Eat
right,
healthy.
right.
There you
and
go.
the first two go along with the three. So if it's really the big two is eat healthier, exercise more, and you hopefully will see some weight loss. And also maybe you're already diabetic. It's okay. Eating healthy and physical activity are our first line of defense for preventing complications. So it's really the first thing you should always do for yourself.
And we talked about the fact, especially at a work site, people don't realize that they have diabetes or they have pre-diabetes. And really the reality, like you said, 10% countrywide, but it's a third in Kentucky. Right.
Well, it's 13% of people in Kentucky have diabetes, but what that third is that a third of people, and this is nationwide, have pre-diabetes. So they're on their way to diabetes. They already have high blood sugar. So a third of the people in the country already have high blood sugar. And at that point, we talked about how you're already seeing some complications come up, even with pre-diabetes. So it isn't it's pre, let's put it off. It's a pre, let's do something about it right now, because we can reverse that diagnosis. That's the only reason it says pre, is because I can actually take it away.
Gotcha. And the reality is, Kentucky, if we're 13% versus 10 having diabetes, and the country is a third, then we're higher than a third.
It's possible that we're even higher than a third. And that is a guesstimate, because most people who have pre-diabetes don't know that they have it. So we are kind of guesstimating that it's a third. It may be more than that. So I think that we talked about advocate, right? Talk to people, make sure that they know their risk or know their potential for risk so that they can have it evaluated.
So back to all right, what do I do? I'm an employer, I have HR, I know I've got people who have it, I've looked at my claims, etc. So we talked about, again, the national program. You said the
Diabetes Prevention Program. It was developed by the CDC, but it's not given by them. We have a lot of local providers of the Diabetes Prevention Program who have a lot of different ways of delivering that program. We've got online providers, we've got people who come on site, they have people like the YMCA holds it at a lot of their branches monthly. They have a couple of different meetings that start every single month. So there's a lot of different ways to engage with it, but we really like it because we know that if you engage with that and do the program, that almost 60% of people remove their diabetes risk after taking that program.
So again, educate, then advocate for people to engage with this. There's again, you handed out some resources. We'll post them on the website. But this was great because there really is action to take. And again, it's a huge issue that we have here in Kentucky.
It's a major issue, yeah. And we're always trying to push people towards do the stuff that actually works. There's a lot of stuff that we could do, but let's do the evidence-based interventions that we know really help the person with diabetes or help the person with pre-diabetes, and also help reduce some of those costs that are involved in their health care.
Makes sense. Thank you very much.
Thank you.
We appreciate it. We're here the third Thursday of every month at Baptist East Milestone. Thanks very much.